All right, it's recording.
Right. Well, welcome to you, Dr. Bill Warnock, uh, from Champlain Valley Center for Natural Medicine.
That was close. No Valley, Champlain Center for Natural Medicine.
Great, great. I really appreciate you joining me today. And I want to kind of give a context of why I was excited to speak with you. In my own practice, of course, I'm a chiropractor. And for anybody that's watching this that does know me, Dr. Heather Rice, and Wellspring Chiropractic is my office. And as a chiropractor, I work in a vitalistic model where I am taking care of people, not necessarily treating a symptom, but to just help people be as healthy as possible. And so it's a different model than our conventional allopathic model where we're looking at finding what a sickness is and treating that sickness. So a lot of the people that work with me, they have values where they prefer to work in a more natural way, keep their bodies healthy and strong, that sort of thing. And so here in this interesting climate that we're in, I'm finding that I encounter people in a whole range where there are folks that are pretty much at ease with the current situation because they know that their own bodies are strong, that they've been using a lot of healthcare practices that are keeping them strong. And then there's people that are just not sure about it all and they have lots of questions. And then there are people that are really afraid. They're really concerned. And even just the prospect of starting to integrate back together into community again. And so I wanted to be able to offer people just some strategies that they can be thinking of for both what are things that they can be doing to just keep themselves strong, as well as what if the worst case happens and they actually are one of the people that get a challenge with having to deal with COVID-19. What are some resources that they can be using? Because when we listen to, at least when I've been investigating and studying what scientists and other doctors are saying, the protocol of intubating in New York City, it looked like the stats were 9 out of 10 that were intubated died. So not even sure that that's even the best way to go, but that's not my field. And so I know that there are lots of ways that we help people if they're struggling with viruses, if they're struggling with their immune system. And so what I wanted to do is just perhaps offer some peace of mind to folks that as we come back together in community, when we think of the idea of the whole purpose of the isolation and the stay-at-home measures was to lessen the burden on the hospitals. That the fear is that this virus was going to come through, it was going to affect so many people, and that the hospitals were going to be overloaded so they couldn't take care of the critically ill that were going to need it. And so that I understood that was the purpose. And so now that we see that really the cases are really low now and that we're starting to integrate again, I think there's some people that think that just avoiding the virus at all costs is the best solution. But I don't think that was ever the intent of the whole social distancing and all that. It was really to just slow down. And so this idea of if we are going to come back together in community again, that we're going to be exposed to all kinds of things, whether it's a coronavirus or the flu virus or a cold or anything else that we all share as human beings. And so that's kind of my intent, is I wanted to hear from other members in our community that are great resources of what if, in the different scenarios, what are things that people can do and what are the resources that may be available that they can keep in mind in case things go sideways for them. So that's kind of it, but I'm happy to hear any thoughts that you have on this situation. So why don't you first start by telling everybody what actually your work is about. You're described as a naturopath. So what actually is that? Some people don't know. And so tell us more.
So I'm a naturopathic physician. My practice is in Shelburne. We have 5 doctors working there. We're all naturopaths. Our focus is mostly primary care. Most of our patients are primary care patients. So the way we differ from, let's say, an MD is that even though we have full prescribing authority, meaning we can prescribe any drug, we try to start off with more natural things. And if they don't work, of course, we're not going to put a person at risk by withholding a drug, but we like to start with the natural vitamins and herbs and those sort of things. But we're also focused very much on prevention. So as primary care practice, we're looking at cholesterol, and for example, and we're looking at a really young age. So when a person is 40 years older, they're not having problems. Same thing with diabetes and those chronic diseases that plague a lot of people as they get older. And we see a lot of acute sort of problems as well. So that's the scope of our practice mostly. And of course, in Vermont, we have unique situations with Lyme disease. We're treating all the time. People are getting tick bites every day, and this is a particularly bad year for it. A lot of my patients have cancer. And that's just the normal percentage of people getting cancer, and I'm seeing them because I'm their primary care provider. And so I'm seeing the full spectrum of illnesses and trying to keep people as healthy as I can. And the things you were talking about with COVID-19, I agree with all those things pretty much entirely. Have to say, because this is still a really new illness, there are really no preventions or treatments for this that have been proven. There's just hasn't been enough time. So there have been some studies, studies in terms of looking at raw data, analyzing raw data, because to publish a study, you have to analyze that raw data in pretty extensive ways and then have your report peer reviewed. And there's not been enough time for that at all. But
of course, Bill, I appreciate what you're saying, because sometimes people want to reduce what's considered as evidence as only something that's been through a randomized controlled trial, and kind of very rigid standards. And yet we know that we have the whole breadth of understanding physiology, and we have ways that we understand how the human body works, and we understand, excuse me,
we got some bugs.
Yeah. I wanted to be outside because I've been inside too much. And so I think that we still need to rely on what we do know, what scientific evidences we do have that would allow us to make connections that are biologically plausible, so we have a direction to go in. We don't want to just be paralyzed and do nothing. We want to work with what we do have, right?
I totally agree with that. And at least the preliminary data shows that vitamin D levels are especially associated with bad outcomes, or low vitamin D levels are associated with bad outcomes with COVID. In fact, a study meaning an analysis of raw data came out of Europe yesterday.
I just saw that, yeah.
And it was really interesting because it said not only were there more deaths with people that had low vitamin D, but there were more cases of COVID among that population. So a lot of people think vitamin D as something that's toxic, but about 6 months ago, a study came out in the Journal of Clinical Pathology, which is a conservative medical journal, and it was a good study, and it basically was saying that for adults, doses of less than 500,000 units don't seem to be toxic. So
less than 500,000.
Right.
Yeah.
So no one can get to those doses unless they're really drinking bottles of vitamin D, which is not recommended, but doses of 5 to 10,000 units of vitamin D, at least with several preliminary studies that have come out, would seem to be helpful for not avoiding COVID necessarily, but having a better outcome with COVID.
And I think that's a really important point, that a lot of the discussions that I have with people when they're afraid and they're thinking of what should I do to protect myself, their strategy is, I just want to avoid it. I just want to avoid it. I just don't want to encounter it. And again, when we come back to that idea of a peak of people getting it and then trying to flatten the curve, I like to think of this idea of, I think it was in the end of December or in early January when the CDC came up with this idea that, look, this is coming and we can expect that 80% of our population is going to have a COVID experience of some kind. And we know that of those 80%, most of them maybe won't even notice it or have a very mild case. And then there's going to be a small percentage that are going to have a more severe case, and then a small percentage of that are going to die. So if we take that 80% of people and we put it into this curve, the idea was if 80% of the people by the end of 2020 are going to have this encounter, we just want to flatten the curve. We don't want it to happen all at once, because those few people that are going to need critical care, we don't want to have the hospitals overloaded. So this idea of taking this peak and flattening it out, the flattening it out isn't reducing the number that are going to encounter it. It's simply spreading it out. And now there's concerns about there being a second wave. So I don't know how all that's going to play out, and I'm not sure anybody does, but that's the point, is that we need to be prepared that if we are going to encounter this, what can we do? So that's why I really appreciate what you're sharing about vitamin D as an example.
It's likely that what you said is true. So far, officially, there's about 1.5 million reported cases in the United States, but some estimates are as much as 30 times more than that have actually had it. But because there's no good antibody test right now, and we've looked and tried some tests, and they're just not reliable. So at this point, no one knows how many people really have had this. So it could be 5% of the population, it could be 10%, it could be 15 or 20%. No one really knows that, but you're right. And people are going to continue to be exposed and continue to get this over the next probably 2 years.
Right.
So if there's one thing a person could be doing, it could be vitamin D. And like I said, that doesn't prevent a person from getting it, but at least preliminary studies are showing that higher levels of vitamin D have a certain protection against bad outcomes with COVID. Now,
we see that with all kinds of health concerns. Vitamin D is a powerful player in your health.
It is. And, if there's one vitamin that I recommend to all of my patients, and, some people come in and they really do say, okay, I'm willing to take one pill. Right. And I tell them, take vitamin D. You're going to get more mileage out of that than anything. Yeah. And everybody, and I've tested thousands of people, probably close to 10,000 people over my 35 years of practice, and no one has had normal vitamin D levels unless they're supplemented.
Yeah.
And that's pretty much the case around the world these days. And as far as other things go, what I tell people is basically what you said. The healthier you are, the stronger your immune system. When you get this COVID-19, you're going to have better outcomes. And not because there's some study done with this or that in COVID-19, but just common sense. If a person is healthier, they're going to have a better outcome with any virus. Mm-hmm. So we don't, like you said, there doesn't have to be these studies to prove that you have to do this or that. It's just common sense to know the healthier you are, the better you're going to fare.
And so just like in my practice and in your practice, we're going to encounter an individual who has an entire history behind them, who has all their own individual unique concerns and habits and challenges and also assets, things that they're already doing. So we're going to encounter those individuals just one at a time, and we're going to look for where are the toxins, where are the deficiencies, and how do we reconcile that to
Right.
just get them back to healthier, stronger.
Exactly. That's the goal of, I think, any doctor. I mean, even an allopathic doctor, they want their patients to be healthier. They have a different paradigm, but it's still, the goal is the same. And uh, when a person sees us, we work hard to get that person healthier through all kinds of means.
What are you tell me this, as far as people that have been more challenged by the coronavirus symptomatically, like they've been hit harder with it. I'm curious if you've had experiences with any of those folks, because I know that I have people there that say to me, if I get hit hard, I do not want to go to the hospital. They're afraid of going to the hospital because of what they've been hearing. So if they needed to have another resource, what has your experience been? And of course, everybody's an individual, but I'm just curious what your experience has been.
Okay, so our office has remained open because we're primary care, and those primary care issues don't go away just because COVID's here. And we have sent many people for tests, for the PCR COVID test, and we've done quite a few at the office as well. And so we've had at least a dozen positive tests with our patients. And all of them have fared well. Some people have had a more severe virus than others with, more fatigue, more typical virus symptoms of achy joints and shortness of breath and all of that stuff. But they've all done quite well. So, that's a pretty small population. So we can't, just say, okay, my patients do better than other patients because it's a relatively small number. There's not that many really positive cases in Vermont.
Right.
But I say, all of my patients are on vitamin D. Most of them are taking vitamin C as, their two main supplements. And both of those provide immune support. If we see stress, we're trying, because, and I should go back a little bit, but I really see stress as the major thing that reduces immune response. So we're in kind of a catch-22 here, because the COVID and isolation is causing people to have a lot of stress.
Yeah.
So we do a lot of counseling as to, well, what can you do to reduce that stress? And, it's just pretty basic things like, okay, are you staying up till 1 o'clock watching the news every night? Maybe you should think about turning that TV off at 8 o'clock and going to bed by 10 and getting a good night's sleep. Are you exercising every day? Well, if not, why? What is it that you can do to exercise? Is it yoga at home? Is it taking walks, gardening, whatever it is? But every day, try to get some exercise. If you're feeling isolated, how can you contact your friends? are you eating well? You know, because you're so isolated, are you reverting to bad habits of eating a lot of carbohydrates and sugars? Well, how can maybe you develop a plan that you're not doing that sort of thing? So that's really important as well. I'm sure you see a lot of people in that situation.
Absolutely, yeah. And that's one of the things that I am keep reinforcing to folks is that the biggest thing that's going to tank your immune system is stress. And we know that when the nervous system is impaired, stress, which is what I focus on, the spine and the nervous system, that when there are the subluxations putting pressure on the nerves, that actually puts the body into a stress response. So if we can just keeping the nervous system clear, it gives you a better place to come from where your body's in less of a stress mode.
Exactly. So we share a lot of patients, of course, and that's what I hear from your patients is that they feel like their stress goes way down once they have a treatment from you.
That's what I hope to accomplish for folks. Yeah. But again, the other part of that is that what are they doing in between visits that they can be empowered so that they keep learning how to turn the stress switch off? What are strategies they can use? And it's the same message: how you sleep, how you eat, how you move, how you think.
Exactly. So those are all really good things. A lot of people, and you really haven't asked about this, but a lot of people have come to me, you know, and they said, well, what do you think of elderberry? Or what do you think of this treatment or that treatment? And, you know, we sell supplements at our office. And for a while, we were having a hard time getting certain ones because they were being bought out. And, you know, what I tell people is those sort of immune boosting supplements are great if you know you're treating something. But just to take elderberry, for example, for a long period of time for prevention, not knowing when you're going to get a virus, I don't think that's the best treatment.
Not as something to rely on, as like that's what I'm going to do and I'm going to be all set. Right.
Right, but how long are you going to take it? 6 months, a year?
Right. Yeah.
It's better to really wait till you see yourself getting symptoms. And a lot of people have been sure that they've had COVID, but because all viruses share certain traits, they really don't know. Mm-hmm. So we're not necessarily talking about treating COVID, but just any virus. Mm-hmm. So elderberry can boost the immune system. There's some studies that are pretty good that show that it can help resolve a virus faster. So, but I don't think it's a good idea just to plan on taking it for the next year. I don't see a lot of value from that, and probably your body would accommodate and not have such a good reaction after a certain period of time anyway. So I'm just telling people, like you said, eat a good diet, get lots of sleep, exercise, don't watch the news and get stressed out every day. And there are things that I'm sure you have that you recommend to people that have anxiety as well, that can help reduce anxiety. So I focus a lot on that these days.
Yeah. Adrenal support, big these days, I'm finding.
It is. And when a person has chronic stress rather than acute stress, that has an effect on the body that is not very good. I see so many people that have had elevated blood pressure, for example, elevated pulse rate, insomnia, all the typical symptoms of having that fight or flight mechanism turned on 24 hours a day. So how can we help reduce that and calm a person down a little bit? And eventually, if that's fight or flight mechanisms turned on for a long period of time, then you'll get adrenal fatigue and you won't be able to have any kind of adrenal response. So we work with that quite a bit, and I'm sure you do too. I know you do.
Yeah, yeah. We have to look at all those pieces. We have to look at, for me, how do we adjust the subluxation and get their spine and nervous system healthier? But how do we teach people how to stop recreating the subluxation patterns that are caused by all the stresses that we're under? So, in my practice as a wellness practitioner, it's not just help you feel better and off you go, and next time you don't feel good, come back. It's how do we keep you strong by doing the things in between visits that are going to be best for every part of every organ system, not just the immune system, every
Right.
organ system. Yeah.
We're not doing our job unless we're educating people to take more control over their life and to learn those unique things that make them healthy, because everybody is different.
Exactly. Yeah. So as I think of where we are going from here, people talk about the new normal, and I really hope that then this is not the new normal of us not being able to have human contact and all of that, because there's a lot of benefit to human contact, including just the strengthening our immune systems by being in contact with other human beings. Like, we need to exercise our immune systems to keep it strong. So this idea of this new normal, what I hope is that we don't go back to the old normal either, because it's the old normal that got us into this mess. So I hope that people have woken up from this, and that the new normal is a better normal, where people are going to be thinking about taking more responsibility for their health, taking more responsibility for their habits, really learning what are the healthiest habits that I can do, and who are the people in my community that are the resources that are going to help me get there, so that we all come out of this stronger. That's really what my hope is that we are not just ready for the second wave and we're stronger, but we are ready for anything that comes in the next year or the 2 years or 5 years or 10 years. That viruses are never going to go away. They're part of us. They're part of they're even inside of us right now. We have our own virome that's part of how we are actually healthy. And so how do we actually live in the best way with our community, and hugging and shaking hands and hanging out, and feeling completely safe about that, because we're coming from a place of strength and understanding and doing what's best.
I agree. For a lot of my patients, this has been a good wake-up call. It's just like, oh, I really should start doing this, something I've been thinking about for 5 or 10 years, and to make myself healthier. And I have seen, the benefits from children staying at home with their parents and having more interactions, for example. And people are calling old friends and having more contact, with that sort of thing. But you're absolutely right. Physical contact is a strong need for human beings. And I hope that we get back to that soon. It's something that we miss.
Yeah.
And I think if a good antibody test comes on the market, and I don't think it's going to be too long, but probably at least 6 weeks or 2 months before that's available, that's going to help out a lot to as far as contact goes, knowing if you've had this virus or not.
And so just to help people that may not really understand the idea of what it would mean for the antibody test. So you mean the IgG, the IgM, like the testing, just say a little bit more about that.
So our body responds to a virus or a bacteria by forming antibodies, and it forms the immune system's memory. So for example, kids up to age 18 develop antibodies to 50,000 organisms. and that averages 7 a day. So most of these things that we are in contact with and form antibodies to, they don't even register consciously. But oftentimes people will come into my office, oh, they have a sore throat, they have swollen lymph nodes. And I say, well, how are you feeling? Great. You have a sore throat? No, but, and I say, well, I think you've got a virus and it's probably going to be gone by tomorrow. So the first antibody that's formed is IgM, and in COVID, it lasts about 2 weeks from the beginning of any symptoms. It's different with different organisms, but IgG then takes its place starting at about 10 days. And because COVID is so new, no one really knows how long that IgG antibody is going to hang around to protect us from future exposures. And then that's complicated by the fact that viruses are mutating all the time. So antibody protection, if it's a mutation that doesn't change the virus too much, offers us protection. Or even if we get that virus, we're going to have a milder case of it. So these antibody tests are looking at whether a person has IgG or IgM antibodies, and mostly looking at IgG to COVID-19, meaning that they've had that virus and they have a certain amount of protection, and how much no one really knows, but studies in the last couple of weeks show that it's probably like most any other flu type of virus. It's going to be several years and it's going to offer a high degree of protection. So if a person tests positive on that IgG antibody when the test comes out, then there are hundreds of tests out there, ranging from $50 to $500, and none of those tests are good tests. But when a good test comes out and able to let a person know whether they've had this already, then it's going to offer some freedom for them in terms of not having all the protections, the social distancing and all of that stuff. And, the government's setting the rules, health departments are setting the rules. So no one knows exactly what it's going to look like once those antibody tests come out. There's been a lot of discussion, but no one really knows at this point.
Mm-hmm. So just so people, again, to get a basic understanding, if you have the antibodies and you are exposed to the virus, it means that your body's already got protection. So if a little virus gets in, your body knows what to do with it. It's going to wipe it out. And it means that therefore, you're not going to be transmitting it because you don't have any viral load in you that's going to share it with another person. Is that a correct understanding?
Yes.
So yeah, so that's why if you've already had it, you're safe around other people, is you don't have a big viral load that's going to expose somebody else. And the viral load idea, I think, is an important one, that if you're exposed to one tiny little particle of a virus, chances are your body can handle one tiny little particle. It's when there's a lot of it and then it grows in a system that is not able to handle it, meaning the terrain or the body that virus lands in, it makes a difference on if it's going to be fertile soil for it to just explode and run rampant versus a healthy system where they're exposed and they just handle it with ease. And so I think that's a concept. Can you expand on that a little bit?
When we get a virus of any kind, we have that virus in our bodies until we make antibodies, enough antibodies to match every one of those viruses. So typical virus, I'm just pulling a number out of the air, might have 20 billion copies in the body. So we have that virus in our body until we make 20 billion antibodies to that virus. And the antibodies bind with that virus, and then other parts of the immune system basically digest it and expel it, break it down and get rid of it. So, that's a crucial part of the immune system. And you're right, if we have IgG antibodies to COVID-19 and it hasn't mutated very much, then our body can form those antibodies within minutes or even hours and just not let that virus replicate and get rid of it when it's in the dozens instead of billions of copies.
So that's why the idea of the more people that actually have the exposure, move through it, get their antibody response, that actually is the best protection for the most vulnerable, is because that reduces the load of exposure for those folks.
Yes, exactly. That's the idea with herd immunity. And, once you reach a certain percentage of people of having had the virus, it doesn't spread anymore because it's really not around. The problem with that is that the vulnerable population, the elderly who don't form antibodies at the same rate as younger people, for example, if they're exposed, they're more likely to die or have a bad outcome.
From any virus.
From any virus, but
Yeah.
this one in particular, some viruses don't kill many people and others do. There was a lot of talk early on with COVID, well, this isn't going to be any different than a flu season. Well, 29,000 deaths from influenza last year in the United States, but we're already at, that was over a 6-month period. And in 2 months, we're already at 90,000 deaths from COVID. And a lot of people think that that's an underestimation. So we could be already at 150,000 deaths or somewhere in that neighborhood. A lot of epidemiologists are projecting that. So it's just, this virus is a particularly lethal virus for people that are vulnerable.
Mm-hmm.
And then there's this phenomenon that's taking place with children where their immune systems are overstimulated, and that's causing problems, and several young people have died because of that.
Yeah, like the having that like a cytokine storm kind of reaction kind of thing.
It's kind of like that, but more complicated. Cytokines are one part of the immune system, but it seems like with these kids it's a Kawasaki type of a reaction, but it's much more complicated than just a cytokine storm. It's only started being reported about a week ago, so it's not really well understood at this point, but it's being seen across the country.
I look forward to learning more about that. Well, thank you so much. Is there anything more that you want to add?
Well, it's just that I think people have to have confidence that this is going to be over, that we're going to get back to normal lives. And I hope that they take those things that they've learned about the importance of good health with them into that new future that we're going to have.
I agree. And I'm so happy to have you as a resource here in our community. So thank you so much for your good work.
Well, thanks for inviting me to this Zoom meeting.
Yeah, the new way the new normal is how we're getting information out to people. Hey, this works for me. I'm pleased. Thank you so much.
All right. Take care, Heather.
You too. Take care.
Bye.
Bye-bye.